Hi, good afternoon, everyone. Well, it's an honor, honestly, to be speaking today at the annual healthcare conference and talking about a subject that lies at the intersection of two great responsibilities. One, which is taking care of the young children, and second, taking care of the planet. So I'll be talking about the eco-friendly pediatric dentistry today. And trust me, I will definitely not speak about planting trees next to a dental chair or even hugging trees while you are sitting in the dental chair. I'll be speaking about strict evidence-based science. So as healthcare professionals, we all know and we all understand the importance of prevention. Prevention not only of the oral diseases, but at the same time also of the environmental damage that we cause in our day-to-day operations of the pediatric dental clinics or any other dental clinic. So let's begin with the thought that sustainability in healthcare and specifically in dentistry is no longer an option, but absolutely essential. All right. So we all know we all are aware of the terms like the carbon footprint, the global warming. Now the climate change topic continues to be of considerable debate. The terms like the sea levels rising, the carbon footprint, it not only leads to alterations in the climatic patterns, but also cause a lot of risks to human health and well-being. The increase in the carbon dioxide emissions has given rise to many physiological issues in human beings, like the overall rise in inflammation, the respiratory acidosis, and also some psychological changes. Now, because in order to address these changes, the WHO in the year 2015 came up with 17 sustainable developmental goals, which encompass the economic, the environmental and the social patterns that need to be fulfilled by the year 2030. Now, in accordance with these, the FDI, which is the Federation Dentaire International, collaborated with the University of Sheffield and formulated a consensus on environmentally sustainable oral health care. Now, this consensus identifies sustainable dental practice with focus on waste reduction, resource efficiency, and oral health promotion. Well, to promote this vision, the FDI came up with a practical framework of, with the practical framework of these terms which we all are aware today: the reduce, reuse, recycle, and rethink. Now, self-explanatory terms, what is reduce? Reduce focuses on reducing the waste generation and also the resource use wherever we can do that. The second is the reuse. Reuse implies utilization of sterilizable and autoclavable instruments wherever infection control allows us. The third is recycle. Recycle promotes that we properly segregate and of course, reuse certain and recycle the waste materials based on the life cycle assessment data. Now, what is this life cycle assessment? Life cycle assessment is a scientific approach that evaluates whether a reusable item has a significant lower environmental impact as compared to the disposable alternative. And lastly, we have the rethink. Now, rethink is that we pause and think whether we need to actually get into the intervention-based care or we can actually stick to the prevention. Carbon footprint. You know, whenever this term comes to whenever we think about carbon footprint and we visualize something, what comes to our mind are the airplanes which, doing all the carbon emissions, or the factories letting out those toxic gases. But have we ever thought that even a dental chair can contribute to the carbon footprint? Now, this really happens in a dental setup. So when we talk about sustainability in healthcare, it's very, very easy to think in abstract terms. But in dentistry, the carbon footprint can actually be quantified. The reason, because we do a lot of procedures every day, and each of these procedures, they have their own carbon footprint. For example, if I talk about the pediatric dental setup, we do the general examination, we do fluoride varnish application, the routine dental cleaning. All of these have their own carbon footprint. But a real impact comes when you add up all of this. The real impact is often cumulative. Now, just to give a brief overview, let's talk, we use nitrous oxide quite often in a pediatric dental setup. Now, I'll talk about this particular thing a little detail later, but just to give you an overview, a nitrous oxide gas is 300 times more potent than carbon dioxide, and it's a greenhouse gas. Apart from that, if we talk about, the water, a dental clinic cannot sustain without water. So on an average, a dental practice, which is a busy dental practice in England, consumes approximately 33,000 liters of water per year. Now, this is an alarming number given that we all the time talk about the global water scarcity. And not even water, even apart from the water, which is only 0.09%, we also consume a lot of electricity and gas, which is almost 15%. So if you really start thinking about the carbon footprint of a dental clinic, it's immense. Well, but material and energy are just one part of the story. The real, the emissions come from something which is less clinical, and that is the patient and the staff transportation. Now, this is something which we really don't think about when we are discussing a lot of things in our practices. But 60% of the carbon emissions come from the patient transportation and the staff transportation. Even 3.1% comes from the business travel. But the good news is that this is that part of the problem which can easily be optimized and without compromising care. And how can we do that? First is by promoting teleconsultations. Now, in dentistry, specifically if I talk about pediatric dentistry, there are a lot of consults which revolve around diet counseling, which revolve around giving the parents instructions and the child instructions on the oral hygiene practices. So this easily can be done by teleconsultations. Then family scheduling. You have the families which have family of 4, we have 3 kids, 4 kids, and you can kind of push them or suggest them to come together rather than coming at different for appointments when they they have to travel every time. Then carpool. We can always prompt our staff to do a carpooling and give them incentives like they can get reserved car parking for them. Then you can also promote the public transport. Hybrid. Now there are so many departments in a clinical practice where you do that which is not clinical, like the insurance management and a lot of other things which are non-clinical. So you can always advise for them for a hybrid work. And when I talk about hybrid, and we stay in Cayman Islands, and let's talk about the hybrid vehicles also. So promote the usage of hybrid vehicles. They consume less gas, and also the electrical vehicles. So and that's how we can definitely take care of the carbon emissions which happen because of the transportation. Well, whenever I think about that, jokingly, I always think, whenever in between the parents kind of sometimes circle around the clinic just to find a right spot, and even the staff transportation, trust me, 2 things definitely rise. One is the carbon emission, and secondly, their blood pressure. So let's control both of them. Okay, apart from this carbon emission, there is another very invisible factor which leads to the dental pollution, and this is the pollution from the heavy metals. Now, we use a lot of materials in dental practice which have many heavy metals like the copper, zinc, silver, lead, mercury. I'm so sure you must have heard about the silver filling which I always make that. The silver fillings, the dental amalgam. There was an era when these fillings just predominated dentistry, and everybody was doing amalgam fillings. Although we are phasing out, and I think most of the practitioners have absolutely switched from dental amalgams to the white fillings, which I'll come on later. But there are still many practices around the world, some countries which are still using amalgam, and trust me, it's got huge human health risks. The reason, because it's got 50% of mercury in it. And this mercury can actually get into the environment through various ways. One such way, I remember when I was a professor, and I'm talking about 20 years ago, when I just started my academic career, I used to see how these dental students, they used to mix mercury and just dispose it anywhere, like anywhere into the wastewater and anything. Although things are changing now, people are switching, but then this mercury enters the environment in various ways. First is, of course, the dental wastewater. The unused amalgam, which you mix and then something remains and then you just dispose without even thinking about it. Also, sometimes, there are people who come who had a restoration 20 years ago and they want to remove and switch to the white fillings. So that's how, when you drill it, it goes again to the wastewater. Now, this mercury, when it enters the environment, this gets methylated by certain bacteria into a very toxic form, which is the methyl mercury. Now, this methyl mercury has the capacity to enter the bioaccumulate in aquatic food chains. Now, this gets consumed by the fishes, and in turn, we eat the fish. So indirectly, it's we who suffer. Pose a lot of human health risks, organ failure problems, and also if you talk about oral health complications, we get osteitis, we get gingivitis, and even ulcerative lesions if we actually happen to consume this through whichever way. So just to talk about a little bit about what's going on right now in the world. So few countries in the European Union, they started banning the amalgam around 2008, 2009. That was when I actually completed my, so I kind of, try to analyze when that exactly happened. So 2008, 2009, we used to hear that few of the countries have stopped or put a ban. And trust me, that was a time, actually, I have never even did an amalgam restoration. It's almost like 17 or 18 years. Then it happened that in 2018, the European Union came up that we cannot do any amalgam restoration for a child who is less than 15 years. And now they're coming up that from July 1st, 2026, they have prohibited the manufacture and as well as import of mercury into the European Union, which is great. I think we all are learning from that. So much so that the United Nations Environmental Program is now pushing the phasing out of mercury throughout the world as much as they can. So presently, we are absolutely following that no mercury or amalgam restoration less than in the children who are less than 15 years. Of course, not in the pregnant and the lactating mothers. And also, no amalgam restorations in the primary teeth. Primary teeth are the kids' teeth or the milk teeth. So we don't do amalgam, but still I had to bring this up because there are a lot of practices who do not follow this and they are still using amalgam. Now, even if somebody is using amalgam, you cannot go to any nook and corner and stop them from using them, refrain them from using this restoration. How can we manage? So if you're using, by any chance, if somebody is using amalgam, you can definitely install certain amalgam separators which can help you capture mercury before it enters the wastewater. But sometimes even these amalgam separators are not enough to actually remove certain forms of mercury like the dissolved form. So in that case, you need to have the advanced filtration systems or the chemical treatments which can further reduce the levels of mercury in the dental wastewater. So mercury, if I talk in any layman term, what is actually amalgam or a mercury in an amalgam? It is just like any guest who comes to your house but refuses to leave. And then it enters your plumbing system. So easily, if you want to understand, this is how you can think about mercury. Well, now the world is switching. Everybody, even including kids, they want white fillings. Nobody wants the black. Nobody wants to open the mouth, yawn, and see and show the black, fillings all over. So, which is a good thing. It's very important because, of course, mercury wasn't doing any good to us. Now we have switched to the white fillings. So if I talk about white fillings, we have a lot which we use. I don't want to bore you that, but we have one of those important part of the white fillings is the composites or the RBCs, not the red blood cells, the resin-based composites. I'm sure most of you must have gone to a dental practice where the dentist might have drilled your tooth, put some white color cream and then put a blue light and then kind of, set it up. So this is, most of us are aware of that. Now this has This is also not environmentally neutral. You know, we always keep highlighting amalgam, but this also has its own problem. What happens now? If you remember, when a dentist put a blue light, why do we put the blue light? Because we want to convert the monomers which are present in that white filling to polymers. These monomers are, sorry, I always keep doing. The monomers are the bisphenol A glycidyl dimethacryl and the triethylene glycol dimethacrylate. Now, these are the monomers which have to polymerize and convert into the polymers. But do all of them get converted? No, absolutely not. Only 60 to 75% of the monomers convert into polymers. So what happens for the rest? Nothing. They just leach out. And trust me, they start leaching out within few hours after you place them in the mouth. Where do they go? The wastewater. So again, they have their own environmental problems, their own footprints, environmental damage. Even when as a dentist, and even I do most of the time, what we do when we place a filling, sometimes you cannot be exact. You kind of overfill and then carve it to the exact right anatomy of the tooth. So when you drill it, where does the extra, those particles go? They get into the wastewater. Sometimes, if I don't know how many of you dentists are here, but then the composites, we have so many composites of different shades and they get expired. So what do we do then? We don't use them and have to dispose. And if it's not a proper disposal, the problems again happen. What we always talk about, the environmental damage. So how can we help? Well, of course, we have methods to deal with this. We can use the catalytic carbon filtration methods. It significantly reduces the BPA levels. Then we can switch to biocomposites and even natural fiber polymer composites. I know the name is very trendy, but this is all in the research and developmental stage. But just to give you an overview of what biocomposites are. Biocomposites, like the composites, your usual composites have the synthetic resin matrix in them. The biocomposites, they are promising that they can replace this synthetic resin matrix with a plant-based resin matrix. And the natural fiber polymer composites, now in the composites we have certain fillers which give strength to the composite because we chew on them. And these fillers are the ceramics or the glass particles, the silica. Now these natural fiber composites, they promise that this can be replaced by the natural fillers like the cellulose, the hemp, the flax, the bamboo. Now this looks very promising and we are waiting that, you know, one fine day, I'm sure down the years, probably we will definitely switch to these kind of composites, which will be very, very healthy for us and also for the environment. In the meantime, I think we also are doing researches on hybrid composites, which will stand somewhere in between. So it'll be a combination of the traditional composites and also the biocomposites. So let's hope that we surely get something like of these materials soon. Okay, so as I mentioned earlier about nitrous oxide, let's discuss a little bit in detail about nitrous oxide. Go to a pediatric dental setup and nitrous oxide is an integral part of that. Why? Because we deal with kids who are full of fear, kids who have anxiety, fear of unknown. They don't want to sit, they're screaming, yelling, they don't want to sit in the chair. So sometimes for the potentially uncooperative kids, which I mean that the kids who want to cooperate but they cannot cooperate because they have immense fear inside, we give them the nitrous oxide inhalation sedation. This is a combination of nitrous and oxygen and also called as the laughing gas. But it's amazing because it calms them. Even in the adult practice, sometimes the adults use it because everybody has the dental fear. But nitrous oxide, as I told again, it's a greenhouse gas. And this is something which has the highest individual carbon footprint in any dental procedure. And if you talk about the per patient episode, it's almost boils down to 91.43 kilograms of of carbon dioxide equivalent. So imagine, I mean, every time you open a cylinder, trust me, from somewhere, the environment kind of screams and stares at you. Come on, doc, really? So we need to really be careful about usage of that. I know it's very easy to, for any child to be to ask to sit in the chair and put a mask, but then we need to be really mindful of this usage. How can we do that? As a branch of dentistry which deals with kids, we have a lot of non-pharmacological ways of handling the kids, which is behavior management. We are taught about that. We are taught about behavior shaping, behavior modification. So talk to the child, remove the fear, call them early, tell the parents, please get your child when the child has a first tooth in the oral cavity. If the child keeps coming every 6 months, from the age of 6, the fear goes away. The child is no longer, it's not a foreign environment. And when the time comes when you really need to do something on the child is not afraid. So that's what we need to practice. We need to tell the parents. And we need and kind of switch to the more of non-pharmacological management. So apart from that, if you have to now this, you cannot compromise on certain things, but if you are using a nitrous oxide during your procedures, we definitely can switch to the low flow delivery where it's an on demand, because these kind of delivery system, they keep on, the gas keeps on coming. So we can switch to the on demand valve systems. Even, we can definitely look for the effective scavenging and ventilation. There is another, by the Medcare, there is another unit, which is the Silhouette. It chemically breaks nitrous oxide into nitrogen and oxygen, and then, reduces the environmental burden. Monitoring and audit, telling your staff, kind of talk to the child, make him comfortable, proper triage, whether really we need to put him in nitrous or not. All these small steps can lead to a bigger change. Training the staff, and of course switching to other sedations like the oral sedation. The oral sedation is also a part of the pharmacological management, using the oral, the nasal midazolam, and lots of others. Well, I've spoken about the nitrous and the water and the energy, but why pediatric dentistry now? Pediatric dentistry is unique. Unique because we emphasize on prevention, and that's the most powerful lever we have. We see the kids when they are very young. Also, we talk to the child, we teach them the proper oral hygiene habits, and then it kind of stays in them forever. We also detect the problems too way early. Even if a child is regularly coming to you every 6 to 8 months, we can detect a carious lesion at the incipient stage. We also have the power to change the behavior, to modify or shape the behavior of a child. Then a child comes with the parents, so we are able to talk to their family. We can tell a lot of things to the family that all these changes needs to be inculcated in the routine practices of a child. And overall, it's a package. So overall, we inculcate the sense of health and well-being in a child. Well, if I talk again of the power of prevention, and some few things which we do day to day in a pediatric practice, is the prevention of decay. Caries is a huge, if you calculate, it's one of the largest prevalent disease all over the world, and we as pediatric dentists can prevent this. And there are various ways. We can start applying fluoride varnishes. Fluoride varnishes are advised for kids over 3 years, every 6 to 8 months. And this helps in reducing decay by 37% in the primary teeth. Then we have the weapon of fissure sealants. At the age of 6 years is the time when the child gets a first permanent tooth into the oral cavity. And the second permanent molars come at the age of 13. So we specifically tell the parents, please get your child at the age of 6 and 13 specifically. That's when you have a new permanent tooth in the oral cavity, and we can seal the fissures, deep grooves, and so that no decay happens. And last, a powerful tool, and I always call this as silver is the new black. Of course, after orange is the new black of Netflix series, silver is the new black. This is silver diamine fluoride, a mixture of silver and fluoride. Silver kills the bacteria, fluoride remineralizes. Very powerful weapon. This is 38% SDF. It's applied on the incipient lesions, turns the tooth dark, but trust me, it has the capability of arresting the decay up to 95%. And this is one of the most amazing, minimally invasive procedure. You don't need to drill the tooth. You don't need any extra efforts. Even in uncooperative patients, sometimes when you're not, the parent doesn't want to put the child in sedation, and as long as you have, you know the limitation, you can do an SDF, and then the life of the tooth also prolongs, and less amount of resource usage. Okay, and yeah, as I told, you can extend the life of a tooth. So what do we need to do? We need to prompt, we need to tell, come for the sealants at the age of 6 to 7 years, and proper oral hygiene practices. This all comes in the power in the prevention, and of course the school programs. Now today we stay on an island which is a very small population. So a pediatric dentistry has the power of integrating this sustainability into the school and community programs. It's very easy, and it's a great opportunity for us to reach the kids through these, a proper prevention-based program, and help reducing the oral disease and also the environmental, the carbon footprint. Now, another thing, we spoke about the prevention. Now let's talk about resources. Every practice, whether it's a dental or medical, we all need resources to practice that. Now, what are the resources? Every time a patient comes and sits in the chair, we instantly need a suction. We need the patient bibs, we need the gloves. So all these come in the resources, and we have to be mindful about which resources and what kind of resources we are procuring. Now, for example, if I talk about specifically pediatric dentistry, we have the maximum waste generation in this department. The reason, because there are certain things which are just suited for the kids. We have smaller mouth mirrors that suit their mouth. We have the specific bibs. We have the specific smaller sized impression trays. So how can we actually reduce the wastage of these resources? That can happen only when we start auditing our items every week or monthly. Every week, if we start having a kind of, a meeting, whether what we have, what is in stock, what we need, and rather than unnecessary ordering, we can, of course, preserve a lot of wastage in the resources. Then, of course, you switch to the reusable. As I spoke about rethink, reduce, and reuse. Wherever possible, please use the reusable items, like the tumbler. You can always sterilize it, and every patient comes and we use a disposable glass. So we can be mindful of that, of using that. The bib clips, the stainless steel suction tips, all these can be are autoclavable. So we can start switching to the reusable items. Barrier films. Barrier films, we perform in an area which is full of aerosols. But there are certain times when we treat the kids and we do not use any procedure which generates a lot of aerosol. So in that case, we can always omit the use of these barrier films, save the resources. Then fluoride varnishes, sometimes for the kids, we get single-packed materials like the fluoride varnish. So it's like a single pack, open, use, and throw. But instead of that, we can actually switch to the bulk package material, because that's how we are not wasting the unnecessary, the packaging, the shipping, and the material. Then if I talk about, we can always switch to the partners who actually give importance to the eco packaging and consolidated deliveries. And again, the right size stock. I'm so sure every practice has something, we always generate some amount of expired items and we have to dispose them. So if we start being mindful about just procuring enough, so much enough that we use them, that'll be an amazing thing in the long run. And believe me, if I say that if we start using something reusable and not use the barrier films, we have to make sure that if we are switching to this, we follow all the infection control guidelines, because whatever we want to change, whatever sustainability, the security, safety of the child comes first. So we cannot never oversee that. Then the eco-conscious daily practice management. The biggest part of the carbon footprint in a dental practice is invisible, and that happens at the back end. That happens in a mismanaged inventory. Over-ordering. When you over-order, you always put a lot of financial burden. You are just putting your money in, and then you're using your storage space. So this, as I told, we need to be mindful about ordering. And again, single use versus it's a debatable topic again. And how can we actually take care of that? By implementing the principle of FIFO, which is first in, first out. Whatever came in first goes out first. So make sure you are using the materials in that order so that you do not end up getting a lot of wastage by the expired materials. Of course, reusable items, as I said previously, single use where required. Keep the lean, stock lean. I know it's so difficult, it's easier said than done. Even I have faced this problem so many times. Many times when you want to order certain stuff, especially when you are on the island, have these shipping problems, you have the shipping delays, and you feel that maybe probably tomorrow this item will not be available. Let me just over order. And what happens? And many times it happens, we end up having so much of wastage, so much of expired items, we have to dispose a lot of things. So all the practices need to be mindful about what they order and try to keep their stock, for maximum 3 to 6 months and not beyond that. We need to conduct monthly meetings in the clinic, talking to the staff, telling them to review all the items, check all the drawers, check all the inventory, what is expiring, to use that first, and not to, without checking the inventory, you do not order anything. So that's very important, although it looks like that, but really it poses so much of environmental, it causes so much of environmental damage, because all these items, they have their own carbon footprint. And also talking about the materials which are expired and which are absolutely unused. We should not be thinking about the carbon footprint right from, because we are disposing them. Think about the carbon footprint right from the time when they started getting manufactured. So manufactured to the distributor, to the shipping, this all had their own carbon footprint. Water smart. We cannot function without, a dental practice doesn't function without water. But why not being a water smart? Everybody is smart. We have smartphones, we have smart cars. We also can be water smart. If I talk about, again, water, an average busy practice can consume approximately 259,000 liters per year. Again, shocking number. And where does this water go? Right from the hand hygiene, right from the oral rinsing, right from the mouth rinsing, and then you need to flush your the pipelines in the dental chair, and this consumes a lot of water. Now, if we have to conserve water, how we can switch this? Now, first of all, the best thing is switching from the wet suctions to the dry suctions. In a wet suction, it's a continuous flow of water and consumes immense amount of water. So it's always advisable to switch to shifting to the dry suction. If there is a leak, please fix it immediately. Let's not wait for a longer time. Track the water usage. You get monthly bills. Track, make a goal, probably reduce it by 5%, 10%. So this is how we can, tell our team to work on this. Then the flushing of the pipelines. All these long flushes, they consume a lot of water. So now we can actually switch to short flushes along with the chemical treatment. So they help you reduce the consumption of water in that. Use the autoclaves and the washing machines only when they are full, which is a common, we can, and the selection of cleaning products which consume less amount of water. So yes, water needs to, it's a smart, and especially if I talk about Cayman, water is kind of a gold, because we use the desalination energy to get this drinking water. So if we actually conserve water, we are actually conserving energy, we are actually reducing our environmental footprint. Well, on a joking note, trust me, the amount of water these suction tips taken, I don't know if I would have taken that, my hydration would have been on a different level. So now, not even water, we all need electricity. We can't function without that. Similarly, a dental clinic, our chairs run on that, autoclaves run on that, sterilizers. So everything practically, it's all about the light. But again, we can be energy efficient, we can start consuming less electricity, we can reduce our electricity bills, and how we can actually switch to the LED lights. We all know they consume less electricity. Motion sensors can be installed in the washrooms, can be installed in the sterilization rooms, can be installed in the hallways sometimes. Use of natural light. We are blessed that we have sunshine throughout the year. Why not utilize it? Open the windows, consume the natural light. Of course, be in the AC, but then yes, that's a great asset we have, and we should be taking use of that. Also, we have immense sunshine, so please, I mean, we can of course start using the solar panels. I'm sure there are a lot of solar panels being used here, but we can, any practice can, it's a great thing that a practice can actually switch to using the solar energy. Digital, I think the world has gone digital, and after going digital, I think there is a 60% reduction in the usage of paper overall. Don't need to tell about how we can go, because I think most of the practices are already doing that. In a dental practice, we can take the consents on the tablet, we can email, we can SMS, we can WhatsApp the recall appointments, we can also educate the child, we can educate the videos, oral hygiene practices, everything can be done through the digital way. Now, yes. Okay, so another thing now, if we talk about water energy, if we talk about the dental materials now, there are a lot of dental materials, your brushes, your toothbrushes, your flosses. So we can also be mindful about these things. For example, nowadays I keep, so many people have come across and tell, oh doc, I think the electric toothbrush works really wonders. But then, do you know what is how high the carbon footprint of an electric toothbrush is? So if you compare, it's much higher as compared to the bamboo or the bioplastic toothbrushes, which have the removable heads. So you can preserve this shaft and you can remove change the heads, and they are very environmental friendly. So we can even think about doing that. Even in terms of dental floss, the bamboo and the sponge flosses are better than the conventional plastic ones. Even if you talk about the interdental brushes, of course, the bamboo ones are much better. So if you can find them, please start using them. We have another part of pediatric dentistry where we do the baby tooth root canals. And there was a time when we had to call the child patient many times to complete a root canal. Now, the world is switching to single visit root canal, single visit endodontics, and because of that, now the new advancement is the single file system. To prepare the root canal, there was a time when we used to use four or five different files to actually, shape it in a particular way. We have now the single file systems. I've been using them for years. They're amazing. Single file, less carbon footprint, less environmental damage. So as dentists, we can definitely switch to that. Orthodontics, that's a 12-year, 13-year, you've seen, all wearing braces. But as dentists, what we can do, we can start getting the brackets in a biodegradable packing. That's what we can do at the procurement level. We can, if you see those wires in the mouth, these wires, they do not get damaged, so they can be, I know it sounds a little yuck, but then these can be sterilized and reused. You can dip them in glutaraldehyde solution and for like 10 hours and reuse these arch wires. Then adhesive system, self-etch, I don't want to get into details, you'll be so much bored. Self-ligating brackets, you don't need the plastic bands to actually secure these wires to these. And then you can also, we can also switch to the latex intermaxillary elastics. At the same time, the orthodontists can also switch to the intraoral scanners. So we have the direct, the cameras where we can actually get a direct picture of the child's mouth right on the screen. I forgot to mention two more important things which we are practicing and everybody is practicing in dentistry is the use of digital x-rays now. We use the RVG, the radiovisuography, instead of the old traditional films where you used to have the films and then we used to dip them in solution and take the dental x-ray. We also have switched now to the impressions, the digital impressions. Even now there are practices, but we used to take impressions with the help of impression materials and pour them in plaster, and so much of wastage and the damage, imagine the carbon footprint. Now we are able to take impressions digitally and send them to the lab. So all these things are taken care by the sustainable alternative materials. Waste management, as healthcare workers, we all know about waste management, but 85% of the healthcare waste is non-hazardous. 15% is the troublemaker. So these waste can be chemical waste, infectious waste. It can be sharps, pathological. They need to go in the right containers. We need to train the staff to dispose the waste properly. It's not only a benefit for the environment, it's also a huge concern for the public health. Rightly disposing these things will reduce the public health hazards. Then it's very important that we, as dental practitioners, or even the dental stalwarts, they should start inculcating, making the sustainability in dental practice a part of the curriculum of dental schools, so that the new upcoming dentists, they can learn about sustainability and can start practicing this right away when they start their practices. So this can become their second nature, and then throughout the life they can definitely learn about all these things. Well, it's easier to, give lectures, easier to make policies, but you need to work for this every day. And this can be achieved by if you make a clinic culture around that. And culture is made by people, your team. So what we can do is we can make a green team. We can, segregate 2 or 3 people, tell them to, work on this, think about every day. And trust me, when you give them the goals, when they own the goals, they do things on their own without you telling them every day or reminding them every day. We need to, we need to have a chart, make a team charter, and make goals like we need to have the electricity consumption less this year by 10%, the water consumption less by X%. So that's how you can give goals to the teams. We are going paperless, prefer bulk supplies, and use the reusable scrubs, uniforms, try to reduce the waste as much as possible. Switching to LED lights, I always said, and whenever you have a new staff, please train them for all these policies so that they can also start practicing that in the day-to-day life. And this is my favorite part about today's topic, which is the patient or the child patient itself. I feel so happy to actually say that we deal with the kids. The kids are the eco-champions. They are so clean-slated. We can teach them. They are open to learning. So this, we can help them develop good habits. We can help them how you can switch off the taps while you are brushing. That an average 2 minutes of brushing can save approximately 6 liters of water. And then when you teach this to the kid, this remains in him throughout his life. So definitely tell them about these behaviors. And there are various ways to teach the kids. We can tell them in the form of, reading stories. Like there was Sammy the super tooth saver, saves water. So because Sammy saves water, you should also save water. Children learn from seeing models. So it's very easy to teach them, to make them understand. They are our ambassadors for the future. Give them 2 minutes brushing challenges. And also we can put posters in all the informative posters in the clinic, so that you can tell them about brushing with a fluoride toothpaste. There are a lot of things which we can instill in the child when they start coming. And our dental setting is a very amazing environment where you can teach them a lot of things. So we have covered a lot of ground, spoke about a lot of things. I know most of the things were pretty boring for you, but then I just want to say that sustainability shouldn't be overwhelming. It's not that everything will happen in one night, and no, we need to take small steps every day. We need to be mindful about what we procure, our items, how we use our water, electricity. So in a gist, all I want to say is prevention is the key. Need to prevent the disease before it happens. Need to choose wisely our instruments, make sure how much carbon footprint they have. That's how you should procure them. Conserve the resources. Engage everyone. You have a team, engage everyone, teach everyone how they can work towards a single goal, and measure and improve. You need to track what you're doing. So if you keep a track, which are areas you are lacking in, and you can take care about that. So, well, sustainability is not a journey, it's not a single action. Before I actually kind of wind up this, I just want to tell you that sustainability, if I talk about sustainability, which is everywhere, I think even you have master's program in sustainability now. So sustainability is not just about conserving water, conserving electricity. It is about, inculcating this thing in your child, in your kids, because these kids, the air they breathe, the water they drink, and the world they inherit, kind of depends on a lot on what choices we make outside the clinic and also inside the clinic. Well, pediatric dentistry, as I say, it's unique and lead by example, mainly because of three things. Firstly, we deal with kids who are clean slate, they are open to learning. Secondly, we emphasize prevention, which is inherently sustainable. And thirdly, we have the power to reach the parents, the schools, and the communities. So these little kids, these little, we are giving them smiles. They should have a healthy planet to live in. In the end, before I leave, I would like to give, acknowledge the incredible research and framework which guided today's presentation. Thank you for being there, and thank you for listening. Thanks a lot. You have a great day.